right, let's talk a little health care. We know the House Republicans were able to pass a health care bill designed to be an alternative to Obamacare, but it did not include subsidies that are set to expire at the end of the year, and they didn't even get to vote on it.
They didn't even get to vote, but there are many critics of the bill, including within the GOP, that say it will not address the cost cliff 22 million Americans could face at the end of the year. Drew Petrimo has been following Congress's health care debate closely. Drew, what can you tell us about this?
Yeah, so they ended up having this vote yesterday. We've been talking all week about whether they were going to have it and whether these ACA subsidies were going to be included in. In the end, they did not include those subsidies. Voted on the package. It's a pretty narrow focused bill that has some Republican priorities, association health plans that allows people to pool together to buy insurance. There's also a way for employers to give tax-free money directly to employees so they can buy their own insurance. They're going to try to rein in pharmacy benefit managers, which is a way to bring down prescription drug costs. But on this big issue where you have all these people that are going to lose these subsidies and have their health care premiums sometimes double in the new year, they did not solve that problem. And the bottom line with this House Republican plan is once it gets over to the Senate, it's almost surely to die.
So Mike Johnson was on another network yesterday, and he was asked, so when would folks maybe start seeing the benefit of the bill if it were to able to pass and get signed by President Trump? He said almost immediately, but he said next year, first quarter, we're really going to do some work on healthcare, the GOP, that is. But let's listen to the speaker defend the bill that was passed yesterday.
The 7% of Americans that are impacted that, it would only reduce their premiums 5.7%. Is that important? Yes, but what we did tonight was something much more impactful. What we just passed off the floor will reduce everybody's premiums by 11%. That's larger than 5.7%.
So a bit of a yay boo for the speaker. Yay, the bill passed. He's happy about that. But boo, this discharge petition also got enough signatures needed to force a vote on the subsidies.
Yeah, and just on the point of the Republican plan that Speaker Johnson was talking about, that the Congressional Budget Office scored the plan and found that it does save a good amount of money for the government, but it also would lead to fewer people being insured. So that's not exactly the solution that many people on Capitol Hill are looking for. Yeah, so this discharge petition is another issue. So after this Republican plan passed and didn't include the Affordable Care Act extension, you had 4 Republicans, moderate Republicans, 3 of them from Pennsylvania, signed on to a discharge petition that's sponsored by Hakeem Jeffries, the minority leader in the House, and that would be a clean 3-year extension of these ACA subsidies. So once that ripens in the new year, there will be a vote on the House floor for that clean 3-year extension, and then it heads over to the Senate where it's going to have major problems. Leader Thune says he's not actually going to bring that to the floor. They actually voted on a 3-year plan last week, right? So Leader Thune's stance is that we just voted on this plan. Why would we do it again?
I will say this. What I did find interesting was you had some Republicans in the Senate say doing this discharge petition, this 3-year subsidy, maybe increases some conversation at least. So while it may not pass, maybe it leads to more talks.
Yeah, let's hear from one of those Republicans. Mike Lawler is one of the moderate, potentially vulnerable Republicans who signed the discharge petition.
You have Leader Jeffries, who clearly is not interested in actually solving the problem. He just wants the message and he wants it to fail so he can use the issue. Otherwise, you would get the bipartisan discharge to move. And that's the unfortunate thing. But my view is doing nothing is the worst outcome.
Sounds like for many of these Republicans, they feel like they were pushed up against the wall.
Yeah, especially for those 4 moderates. And it'd be interesting to see when it comes to the House floor how many Republicans end up voting for it. As you said, over in the Senate, it's going to be very interesting to see what the Senate wants to do with it. Our reporter, Alex Bolton, has some very interesting quotes in an article that he posted this morning about just the pressure that's going to be put on Republicans after the House passes this, assuming that they do. What do the Republicans in the Senate want to do with this? Does this cause them to say, okay, we're not going to pass the Democrats' bill, but maybe we'll use this Republican plan as a vehicle to enact some slate of reforms that could include a temporary extension of the ACA subsidies? You're hearing more sounds like that from senators, Republican senators, saying maybe we can come up with a plan that would include some kind of short-term extension paired with reforms. But then the problem is you have to get that back over to the House side with those changes, and what kind of a mix of Democrats and Republicans can you cobble together that would pass that plan?
So let's run the numbers now that these tax credits are going to expire. According to KFF, what was an average cost of about $888 in 2025 for somebody who took advantage of these tax credits in Obamacare. That's going to balloon to about $1,900 in 2026. How many people is that? Well, in D.C., about 3,400 folks rely on these tax credits to help subsidize their health care. In Virginia, it's about 326,000 people, and in Maryland, about 181,000 people who rely on these tax care credits. It's going to be the topic of conversation as we head into the new year for sure, even with midterms in November of next year.
Yeah, and you have a huge group of people that when the new year comes around, they're basically rolled over into the plan that they previously had. And those people are going to start getting their bills in the new year. And they might not be fully aware of this debate that's happening. There's a lot of people that get no cost plans that because their income is so low, they get their insurance for free. All of a sudden, they're going to get hit with a premium. People are going to all get these bills. There's going to be a sticker shock in the new year. And that's when the phones start ringing on Capitol Hill and pressure continues to build.
And then there's a January 30th deadline to fund the government.
You know, it's interesting, though. I saw Chuck Schumer yesterday said that they were not going to shut the government down over this issue.
We'll see what the base has to say.
Yeah.
And whether Chuck Schumer actually believes that.
Yeah.
Drew, thank you so much. We appreciate it.